Now, it's very difficult to remember, yeah? Now what we have done, okay, this is identified as a simpler form of Glasgow Coma Scale called ABPU. Is the patient awake and responsive? Is the patient responsive to voice? Is the patient responsive to pain? Is the patient unresponsive, basically? And you can marry that into Glasgow Coma Scale. We've got to talk about a lot of that in 2 days, okay? Right? That's about assessment of neurological assessment. Second thing I want to do, a pupillary assessment, okay? Use the torch, basically, and run, okay? What should be the reaction? People should be equally reacting to light, yeah? That's why, when you open the eyes, there is a method of assessment, yeah? Okay? You need to check whether pupils are dilated, pupils are pinpoint, whether there is an emergency neurologist referral needed at that point. Has the patient had a head injury? Okay? Right? Or might be opioid overdose, we don't know. Right? But you're assessing at this point and you're putting emergency call out if there is dilated pupil there. Right? And then third thing, you do blood glucose. I don't know, might be a blood glucose might be a problem. This patient is unconscious. So for example, if you've only done airway, you've done breathing and circulation, you've given 2 lots of fluids, but still the patient is breathing but unconscious. If you haven't gone to D, you might have missed that hypoglycemia. Yeah? Let's say patient blood sugar is 25 milligram per liter. You mean? Right? So, hypoglycemia. So you might need a dextrose, 25% dextrose, that's what you use here. But nurses can't do that, you need a prescription. Nurses can do a glucagon. Okay, yeah, that is what we do in a hypo kit, yeah, but 25% glucose need a prescription, and you can't give peripherally unless cannula is very good, yeah. These are things you need to be considered. Two more important: is the patient having any pain? Is the patient having visually epilepsy? Yeah, seizures. Last one you do: airway done, breathing done, circulation done, disability done. Last one: draw the curtain, maintain the dignity. Okay, expose the patient, start from head to foot examination. Is there anything wrong that is causing this patient unconsciousness or deterioration? Any injury on the head? What's the neck like? Is it tracheal central? Any injury on the chest? What's the chest like? Is it dry? Any chest drain there? What's the abdomen? Is there any post-operative wound? Is it dry? Is there a fresh blood coming out? If the fresh blood coming out, you don't take the dressing off. Put extra pads on. Put an emergency call to surgeon, okay? Right? Okay? Then come to perineal area. Is everything okay? Lift the leg and see, is the patient having diarrhea? Feel the calf. Are they soft? Are they tender? Look at the toes. Is there any wound? Might be a diabetic patient having a wound which is infected. That might be causing sepsis, septicemia. Patient is deteriorating. Are you with me? Yeah? At the end, you've done ABCD as much you could as a nurse. You prepare, put this patient on 15-minute observation, do an accurate urine output chart, make sure observation chart is up to date, yeah? Get the notes, look at the blood test that you sent, has that come back? What's the full blood count like? All those, yeah? And then prepare for a handover if the doctor is coming. Doctor will take any hospital to come here to take at least 2 minutes. Or some doctors, depends on the early morning score. In our hospital, somebody's score is 3, they will take 30 minutes to come, minimum. That's the policy. Within that 30 minutes, you've got to do a lot of things. All these things are done by nurses. Nothing complicated. Yeah? With me? Right? Medication need prescription and all that. That's right. How do you communicate? How do you give a handover? I spoke about earlier. That is the simple tool. Situation is, I found this patient unconscious. Background is, patient is having a known pneumonia patient admitted, or patient had a laparotomy, okay, for small bowel resection. With me? Right? Assessment wise, unconscious, started on oxygen, responding very well. Okay? Significant, I'm saying. Circulation wise, blood pressure was 80 over 40, responded really well. The current blood pressure is 130 over 60. Right? Assessment point, important is abdominal wound I have observed, fresh bleeding. I want you to have a look at it. I recommend you to prescribe more fluids and look at the wound and this patient might need to go to theatre or ICU. How did you feel that went? Now you're going to do that at least so many times. We're going to go through with the renal scenario. Somebody is having low urine output. We're going to go through with somebody is having intracranial bleeding. Same method, ABCDE. Okay? But you might identify in D. Okay? We're going to go through with the hypoglycemic patient. We're going to go through with respiratory patient. Somebody has got COPD. We're going to go through with somebody who's coming with chest pain. What would you do? Okay? Right? Just quickly to show you the program, what I cover in 2 days.